Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson on surgery and nutrition in IBD. So when injury occurs to the body reacts using metabolic stress responses, which involves the diversion of nutrients to the site of injury to help in the healing and recovery process, instead of maintaining the protein mass of the individual. Having surgery also activates metabolic stress responses, and the more complex the surgery, the greater the stress is on the body, resulting in a greater metabolic stress. In IBD patients who are malnourished prior to surgery, the extent of their malnourishment should be taken into consideration, along with the type of surgery being proposed, as this will have an impact on the outcome and success of the surgery as well as in the recovery of that person. In those who are diagnosed with malnutrition prior to surgery, it can be recommended to delay their surgery for up to 2 weeks to provide intensive nutritional support. The provision of nutritional support before surgery can help in post-operative recovery, as these patients have a greater energy requirement and reduced body stores, as well as early nutritional support can decrease the risk of complications after surgery, especially in those with Crohn's disease. Nutritional support can involve the use of food, exclusive enteral nutrition, or parenteral nutrition. And any nutritional supplements given prior surgery should be done under the guidance of the appropriately qualified healthcare professionals, as overfeeding can have negative consequences on outcomes as well as on overall health and welfare. During the perioperative period, it is recommended from a nutritional standpoint as well as a metabolic aspect that long periods of fasting should be avoided before an operation. And oral intake of food should be restarted as early as possible post-surgery to help in the recovery process. It's important to also have a post-surgery nutrition care plan, and this should be created and followed by the healthcare professionals that are taking care of you. As well as movement post-surgery should be done as early as possible to help protein synthesis and preserve muscle function. So those who are unable to meet their nutrition requirements during the perioperative phase through either normal foods or normal foods with oral nutrition supplements are recommended to have oral nutritional supplements and enteral nutrition respectively, while those who are malnourished prior to needing emergency surgery should be started on either enteral nutrition or parenteral nutrition. It is recommended that parenteral nutrition in the perioperative phase should be used as a supplementation to exclusive enteral nutrition and can only be used as the primary form of delivering nutrients in case exclusive enteral nutrition is not possible, either due to that person being unable to obtain feeding tube access, having severe vomiting and diarrhea, or intestinal complications such as obstructions or ischemia being present. Now, the type of post-operative nutritional support that needs to be provided will be determined by the type of procedure performed, if any complications occurred during the procedure, the amount of bowel that was removed, and how much of the remaining bowel is actually functional. For the majority of those with IBD who have surgery, there are no dietary restrictions aside from having a high protein or a high energy diet to help in recovery. In some patients, such as those with strict-during Crohn's disease, a low-fiber diet may be advised as the bowel can be swollen and have changed motility for up to 6 weeks post-surgery, and so restricting fiber can help in reducing the risk of obstructions occurring while the bowel heals. So to summarize, we've discussed the impact of malnutrition in surgery, and we've looked at factors to consider when operating on malnourished patients, as well as looking at the types of nutritional support given to these patients.